Bismillahirrahmanirrahim. I am Professor there with a long experience of medicine, and we will talk about an introduction to preparation to entry into medicine. Most of you have a desire to become a doctor. Once upon a time, doctor and engineer were the two professions which were mostly selected by the young persons. Now, of course, we have many other options, but still the dream of becoming a doctor is at the top. Because you are here, so we welcome you all, and we are very happy that you are going to select your profession as a medicine. I personally and all profession welcomes you, and we are happy that you are here. The profession of medicine, it is change, a drastic change will take place in your education. You have been in your schools, and where you were taught some lectures, some material, and then you have been tested. Now there will be a drastic change. This is life. You have to deal with living patients. So you will have a great change, and life, what the people say, the wise people say, that in comparison to a school where you are taught and you are given a test, in life you will be given a test and then you will learn a lesson. So this is a great change. We will just have an overview that what can make you a good doctor. Many terms have been used for good doctors. Sometimes there is a time when we call 5-star doctors, successful doctors. So all these they tell us that a doctor has to be successful because he has to deal with the patients. The one thing which I tell you with experience is that preparation is the key for all this. For every profession, especially for medicine. Now, I have summarized all these preparation points into 5 Ds. You are well aware of 5G. So, 5 Ds for this profession to enter is, first is that you have taken the decision. You have decided to become a doctor. You have decided to enter medicine. And this decision has come from your desire. So it is your insight that has forced you to become a doctor. When you have decided this, now please follow. First at the top is the discipline. We want that your life should be completely disciplined. We have to go in a straight direction. This direction is direction of medicine. This direction is direction of well-being of a human being, of the human. This direction is the main theme to become a good doctor. For all this, you will need the 4th D as determination. You have to decide one thing, you have to stick to this, and you have to have full determination to learn and to apply. When you have to acquire a great knowledge of medicine, you should learn that how to digest this knowledge. Digestion is a process which keeps us alive. Digestion of food. Similarly, digestion of knowledge is a proper way to gain knowledge, but this gain of knowledge should be prevented from any unwanted things to happen. like vomiting. This should not happen. So this digestion of knowledge will make you happy, healthy, and a good doctor. Now all these 5 Ds, please keep in your mind that you have to keep in yourself, learn yourself. Now when you have entered, when you have decided to become a doctor, but there are some expectations, and these expectations, they are in 2 steps. We can see those. One is what we expect from you as students and us as growing doctors. Second thing is, what do you expect from this program, from the program of medicine, any program of any university, any program which will make you doctors, which will make you to enter into this profession. As we have seen that this medicine profession which you are entering now needs that you have to learn yourself. This is again a change from your school age. Nobody is there to feed you. It is not what we call a ready-made food. Books, internet, materials, YouTubes, professors, teachers, all are there to help you. But main theme is that you have to go for self-directed learning. If you have decided to learn, you will learn. Nobody can force you to learn. So this is the main message that we want to give, that self-directed learning, you have to take help of library, for example. A lot of material in library, lot of books, up-to-date material. One thing which I will summarize, when you enter this profession, you have decided to become a doctor. That means you are lifelong learner. Please remember, there is no stopover, there is no gap, there is no break in learning. When we learn, we apply it to the patients. If we have a stopover or a gap in our knowledge, we will miss the up-to-date knowledge. And this up-to-date knowledge is a must for treatment of the patient. And all of us, we have to deal with humans, with living peoples. So they also expect that you have to heal them with the help of Allah, with the help of God. And this can be acquired when you acquire a knowledge which is the latest. So as a doctor, I will say that you have 4 R's. You have certain roles which you have to show, certain rules which you have to obey, certain regulations which you have to follow, and many responsibilities which will make you a good doctor. So this needs a lot of desire to acquire knowledge, and a constant struggle. For all this, we just summarize again that lot of things are there to help you, but main theme that you want to acquire knowledge, acquire skill, acquire medicine, or to specialize in medicine, and then you will have lot of sources to help you, starting from the book to the tutors, to teachers, to libraries, the internet sites, YouTubes, all of there is to help you. But main thing is that you have to acquire, you have to desire, then acquire the knowledge and apply it. This is the message that I will like that you should keep in mind when you are entering, when you have decided to enter this noble profession. Thank you very much, and I wish for your success. Thank you very much.